Hi, I'm Dr. Sandra Adams, and I'm a lung doctor. In this series of videos, I'd like to talk with you about some practical tips to help you or someone you love stop smoking. First of all, it's a proven fact that for many people, stopping smoking is one of the most difficult, if not the most difficult thing to do. But it is possible. We're going to talk about a series of tips to help if you're ready to get serious about trying to kick the habit and you really want to stop. Tip number 3, learn the risks of continuing to smoke and the benefits of quitting. Most smokers know that smoking is bad for you and most want to quit. But because tobacco is so addictive, they often fool themselves into thinking that they themselves won't actually get sick. Smoking definitely causes chronic obstructive pulmonary disease, or COPD, and is common in other types of really bad lung diseases as well. But for some reason, not all smokers get COPD. Most of us know 1 or 2 people in their 80s or 90s who've been smoking their entire lives without any apparent medical problems from it. But this is really rare. Maybe you'll get lucky if you continue to smoke, but it's kind of like playing a lethal game of chance with 5 bullets in the gun where you spin it, you have 5 bullets instead of 1, and then pull the trigger. That's obviously not a good thing. This type of game is illegal, and just about everyone agrees that it's a really stupid thing to try, but somehow the mind fools itself into thinking that smoking is bad for everyone else, but not me. The chances are that nearly all smokers will have 1 or more bad problems because of smoking. Smoking is linked to number 1, heart disease like heart attacks. Number 2, strokes, which are sometimes called brain attacks. Number 3, many of the cancers. Number 4, circulation or blood vessel problems. And number 5, many others like wrinkles and sexual problems, yellow teeth and hands. So if people already have 1 or more of these problems, does it matter or help if they quit? To find out, take a look at myth number 3. The bottom line for this tip number 3 is that smoking really is bad for nearly all people, which likely includes you. So get help if you're ready. Try to quit by either, number 1, calling the 1-800-QUIT-NOW helpline, number 2, talking with your healthcare professional and or going to counseling, number 3, taking advantage of all the other help that's out there and available today. Myth number 3, if I already have a disease such as chronic obstructive pulmonary disease, or COPD, heart disease, or cancer, the damage is done and it's not going to do me any good to stop. The reality is, this is absolutely false. Stopping smoking helps people with heart and lung disease live longer, feel better, and lowers the chances of getting worse. If you don't yet know that you have a smoking-related disease, the great news is that stopping smoking has many benefits. Within 1 year, the risk of heart disease is cut in half. In 10 years, the risk of lung cancer is cut in half. And in 15 years after quitting, the risk of dying from a heart attack or a stroke is close to that of someone who never smoked. So, stopping smoking is very important, even in those who already have a disease caused by smoking.